Assalamu alaikum. Welcome to Medic Hour. This is Rabina Mir, your host for the show today. Today is a live show. In the hot seat today, I'd like to welcome back Dr. Raj Rithetti, who's here to answer questions about any concerns you may have around cosmetic treatments. We decided to do this program today because there's a growing trend within our community where lots of our, not just women and men, I'm going to check about the gender issue here, but there are people within our communities as well as other communities who are now relying more and more on anti-wrinkle treatments and something that we call fillers. So we're going to learn about those, and we're going to think about how we can stay safe if that's a procedure that you want to follow. So if you'd like to ring in and ask any questions, you've got any concerns, or something's happened that you're not quite sure about, Dr. Raj is our surgeon in the hot seat today, and he's happy to take any of your questions. So hopefully you can see at the bottom of the screen the number coming through, which is 01274 214 299. So we look forward to hearing from you as the show progresses. So welcome back, Dr. Raj. Today is very much around treatments that we don't have on the NHS. These are more things people do privately. But the reason we decided to discuss them is because we know lots of people are taking risks with them. And I thought before we start talking about the risk, let's understand a little bit about where these treatments come from. Yeah, so what's the history of anti-wrinkle treatments?
So firstly, thank you very much for having me again, Rabina. You're probably sick of the sound of my voice.
No, not at all. It's really useful to have you here. Thank you.
So in terms of these cosmetic procedures, they've been gaining a lot of popularity.
They have.
Mainly over the last 5 to 10 years, but going backwards, we've got a good exponential rise of the last 20 years or so. Okay. Before that point, surgery was the main way that people could change and alter their appearances for cosmetic reasons, but also, and equally validly and sometimes far more importantly, for reconstructive reasons. So for instance, women who've had breast cancer, or if you've had there's been big things in like kind of after military accidents, and having kind of reconstruction of faces or reconstruction of limbs.
Sure.
It's really, really important to make sure those people are cared for at that time when they need it most. So for a long time, you can take surgical procedures altering people's appearances back all the way to ancient Egypt.
Okay.
And there's even evidence in ancient Egyptian mummies that they have been mummified with extra kind of small bird bones put into their noses to try and hold the shape of their nose after death, because the nose would obviously disintegrate, to hold that shape and to make sure that they're recognizable in the afterlife. So and through to ancient India, doing kind of taking bits of skin from one area and reconstructing different areas back about 600 years, kind of BC. We're talking a long time ago, all the way through to kind of what we now do. So having surgery as a possibility to alter your physical appearance for aesthetic reasons, for kind of cosmetic reasons, or for actual reconstructive reasons, it's always been there.
Okay.
And
we're not here to promote this. We're actually talking about this because we want to make sure the communities who are using them know about the risks.
Completely.
Stay safe.
So we need to make sure that, up till about 1981 is when the first kind of non-surgical techniques started coming through, and they actually used to use cow collagen and inject that into people's faces. But even in the 1800s, there's evidence of people injecting kind of paraffin wax into people's faces to kind of give lift or everything. Sure. Obviously, they ended up with most likely horrible reactions and horrible infections.
I'm sort of smirking, so I'm thinking in my day when my mum used to tell me I had a pakora nose, I used to put a peg on my nose. That was as much as I used to do. But today we've just got so much on the market, haven't we?
There's so much. And only recently, most likely in the last kind of 5 to 10 years, has it suddenly become almost like a fad. It's just like a thing that people are doing.
You see it on the telly all the time, on morning shows.
That's one of the reasons why I'm here today. It's just to make sure we are clear that these aren't just an extension of your beauty regime. This is not just adding a bit of makeup here and there is not the same as having these procedures. These are serious medical procedures and should only be performed by people who know what they're doing, but also can only be performed from a patient point of view if you have seriously considered all of the information that's been given to you by your practitioner. You've made an informed decision, you understand the risks, you understand the benefit, and overall it's going to be of benefit to you, and it's not just a fad, and that's the most important thing. 2 calls coming in, so maybe we should start. Okay, hello caller, who's calling?
Hiya, it's just Alina calling.
Hello Alina, what's your question? Where are you calling from?
I'm calling from Birmingham.
Okay, lovely to hear from you. Is it Alina, did you say?
Selena.
Selena. I've got a bit of a bad line. Okay, what's your question, Selena?
I just wanted to know the consequences of using Botox.
Oh, okay. Now that's a brand name, isn't it? The question is, what are the consequences of using Botox?
What are the consequences?
Which isn't a name we would use because that's a brand name, isn't it?
So the B word that, thank you Selena for calling, I really appreciate your time.
You're welcome.
So what she's referring to there is Botox, which is a brand name for an anti-wrinkle treatment.
Okay. I think we've all heard of it, haven't we?
We've all heard of it, but we're not allowed to say it.
Because it's a commercial
because there are
product,
many other brands available. But anti-wrinkle treatments have been around for a long time. They are really, really common in the modern day, and lots of people are using them. But again, it is a prescription-only medication.
Oh, is it?
Yeah. So
you can't just go to a clinic and say.
No.
Okay.
So it can only be prescribed by a doctor, a dentist, a registered nurse prescriber, or a prescribing pharmacist. So those are the only ways you can get it in the UK. And it has to be if it's actually in your benefit. You can't just go in and request for it. It's not. It doesn't work like that. In terms of the long-term consequences, those anti-wrinkle treatments that we just talked about are normally short-lived. So most of them only last about 12 weeks or so if they're used in the face to actually reduce wrinkles and reduce the appearance of lines, fine lines and wrinkles. So they last about 12 weeks.
They last about 12 weeks. We hear about celebrities using them all the time, Bollywood, Hollywood.
Exactly.
Are they getting prescriptions for this? Because some of the mistakes you see on the internet, you kind of wonder if they're getting the right advice.
Depends on the local law. Right. So in the UK, which I think is the only way I can comment on because I live here and I know the law here, it is really strict and as it should be because it's a really, it's a life-altering medication. It works very well when it works, but there are risks and we can go into those a bit later on. Bollywood and Hollywood, yes, I'm sure a lot of the celebrities are using the treatments.
Apparently.
And they probably go into hiding. Probably going to hiding allegedly after using them just to make sure that they, don't get the obvious kind of downtime isn't really obvious to the public, and then they come out bright and sparkly and as they were 2 weeks ago.
Yeah, I can think of a few celebrities, and I think you can tell something's been done, and it doesn't always look like they've had a good job done.
No.
We won't name names.
We won't name names.
In this country, there's lots of strict rules around being able to access that.
Completely.
So in terms of the side effects, you said it wears off after 12 weeks. So is that the only period you'd have side effects?
So it depends. It depends. So the anti-wrinkle treatments that we're talking about here, although they've just been obviously just as in the last kind of 20 years been used for facial rejuvenation and getting rid of fine lines and wrinkles, looking pretty, they have a massive background of actually being used for medical purposes. So these medications have been researched very, very thoroughly, mainly originally actually in children with cerebral palsy. So children who have normally from birth have got a problem with mobility issues and got really stiff muscle spasms. And these anti-wrinkle injections can injected in much higher doses into their big muscles to try and relax those muscles and help with their physiotherapy and help with their movement. And
so really important and useful way to use it.
Really important. That's why it's not classed as a, it's not for cosmetic procedure. It's a medical procedure, and that's ultimately what it boils down to.
We've just got another caller.
Another caller, yeah, sure.
Yes, hello, hello, caller. Who's calling? Oh, I think we've lost them.
Lost them? No, it's fine.
Okay. So coming back to the sort of questions that I was asking you, in terms of this procedure, even though you're saying that historically they've been used for real serious medical conditions to be helpful, we're also recognising that they're being used for more to improve the looks of people's faces.
Agreed. Although saying that, they are still being used in the medical terms still today.
Okay.
And even while I've been in hospital, on a surgical job, lots of people have Botox or other brand names of anti-wrinkle injections put into various bits of their body to try and relax certain muscles. It's used quite heavily in general surgery and abdominal surgery.
Okay.
It's also used in a lot of plastic surgery as well.
Okay.
There are lots of reasons why you need to use these medications in order to help relax muscles, in order to give a therapeutic effect.
Okay.
The fact that we're using this just also as on a sidearm in the cosmetic kind of world is a sidearm.
Yeah.
Its main use was originally in the medical industry.
And I know that we're going to continue the conversation about how to stay safe if you are using them for those purposes. Can I just come to the question about how they're used today? Are we talking about both men and women? Because I get the impression it's a trend now in men as well as women.
Yep, so there's a massive push in males having these treatments done, and actually generally just looking after themselves more. There's the kind of term of metrosexual, which is kind of someone who's a man who takes care and pride in his appearance, does his hair, does his skincare regimes and everything, and is a kind of a whole package of, and it's not just those people, but there's lots of people who don't do all those things but are interested because they're getting to that age where they can actually start to see certain problems and they're worried about stuff and it's affecting them. We don't
all want to age, do we?
We've
got another call waiting, right?
Yeah, sure.
Okay, hello caller, who's calling?
Hey, Miss Jamila.
Hello, just say that again.
Jamila.
Hello, where are you calling from?
London.
Okay, hello, what's your question?
My question is, if somebody wants to do a lip filling, filler, I don't know what's it called.
Yeah.
Would it be Botox, part of the Botox?
So you want to find out about what people use to fill their lips out, because that seems to be a new trend at the minute.
Fill it up, because sometimes the lips are inner going, and she has a problem. It touches her teeth. The lipstick touches her teeth.
Is it Camilla? Did you say?
Yeah.
Okay.
Thank you very much for calling in, Camilla.
Thank you, Camilla.
Thank you for taking the call.
That's okay. That's fine. That's okay. So is the problem the fact that when they smile, the lips curl in a bit?
Whenever I put the lipstick,
the
lipstick is touching the teeth all the time.
Okay, fine.
It's gone inner.
Yes, I understand.
Outer.
So does that make the lips sore?
I understand. No, so what they're talking about is the fact that if I understand correctly, Camilla, is the fact that having a thinner lip means that it's more difficult to apply your lipstick, and actually the lipstick is actually touching your teeth. Is that correct?
Yeah, it's because it wasn't like, the lips were not like this before. They were different. They were
how old is the person? How old is the
now
person?
they're inside for some reason.
How old is the person in question?
The person is about 65.
55.
She
okay.
She looks very young. She looks like 55.
Okay. So there is a really complex aging process that happens in the lower third of the face as you start to age, and it starts on various levels: skin, fat, muscle, and bone. And as those aging processes occur in their various forms, what we classify as the lip is actually, we split it up into two different areas. There is the white lip and there's the red lip. So the white lip is from the bottom of your nose to the top of your actual, what we call the lip.
Yes.
And then the red lip is the main bit that we call the lip.
Okay.
And where they meet in the middle is called the vermilion border. And the problem is that as you start to age, there is normally a lengthening. The white lip, the area between the distance between your nose and the top of your lip, actually get bigger. They get longer, and that is a sign of aging. So when you look at someone who's slightly older, you'll notice that their lips look smaller. That's also because the white lip has actually got longer, but also the lip itself has lost volume, it's lost definition, and actually it starts to curl inwards.
But there must be an answer to a filler.
Yeah, so in that area, using anti-wrinkle treatments is not advisable in the first instance. In those cases, it needs to be taken on a case-to-case basis. But in those areas, from what it sounds like, having dermal filler injections would be a better option.
And is that an injection as well, or is that something else?
That is an injection as well,
Okay.
and it's injection of a substance called dermal filler, which is actually
Is it very expensive, or is it?
So I mean, it depends where you are in the country.
In London.
But it also depends on how much you need in order to get the result that you want. A lot of people are, on a budget, and that's completely understandable. But you need to be aware that it is a serious medical procedure that you're undertaking. And I'm not here to advertise the procedures. I'm here to make sure that you're aware that there is a risk attached to it as well. But it depends. It depends how much you want and what area needs filling. The prices range from somewhere like £120 up to I know people who can charge £300, £400 for them.
So Raj, what would you recommend for this particular lady then? I mean, Camilla, it sounds like you're ringing in on behalf of somebody.
Yes.
So I just wanted to check. So what advice would you give to somebody?
So she needs to go to a practitioner. She needs to go to someone who does the aesthetic side and needs to get a formal consultation to see firstly whether this is even for them at all or not.
So this is not a GP, we're talking about
it needs to be a private practitioner.
Okay.
It also needs to be, you need to see whether, whether the risk actually is worth it and whether the benefits outweigh the risks. Okay. And that's something that needs to, it's a one-to-one decision that needs to be made for that person. I've had people who come to me and they want some procedure and I've said no because actually the risk is more than the benefit, and that's why it's really, really important. It's a very, very personal decision that has to be made with each patient personally.
I hope you found that useful, Camilla. Thank you very much for calling in.
Thank you.
Thank you very much. Have a nice day.
So, we've got another call. Hello. Hello, caller. Who's calling?
Hello.
Hello, who's this? Hello, can you hear me?
Hello. Yes, I can, yes.
Who's calling?
It's Syra from London.
Syra from London, thank you.
Hi, Syra.
Hello.
What's your question, Syra?
My question is, I want to know what are the benefits of having Botox and is there any other alternatives?
Okay.
So, and other treatments exist, of course.
and other brand names
do
exist.
As well, yeah.
We knew this was going to happen, so don't worry, it's fine.
That's fine.
So the benefits of it are basically the way that it works is, because I don't think we've actually talked about that yet. So
no, we've not.
We'll probably need to explain what's actually happening. So these treatments, these anti-wrinkle treatments, are basically are made by a bacteria that we've purified the exact substance. And it's what we call, in the medical term, it's called a neuromodulator, which basically is a big fancy word that means it affects the way that nerves work.
Right.
And where in your face, where we inject these things, these anti-wrinkle treatments go in, they get absorbed by the skin and the surrounding tissues, and they go and find the nerves that are in the area, and they basically block the nerve channels the nerves are all attached to muscles, and once the nerve excites, your brain tells them. So for instance, you're talking to me now and I'm raising my eyebrows. That's because my brain is telling my nerves to tell my forehead muscle to contract, and those nerve signals are telling the muscles to contract and move. By using these anti-wrinkle injections, they're basically blocking that nerve signal. So by blocking the nerve signal, the muscles stop moving. The degree of movement is dependent on the amount that we inject.
So sorry if I'm correct, you're asking what the alternatives
The alternatives are, it depends what the reason for the treatment is. If the reason for the treatment is to soften the lines and wrinkles, then yes, there are many, many other treatments available. And we're not just advocating anti-wrinkle treatments. There are many other treatments available. The question is how far those treatments will be effective and whether they'll give you the same result as an anti-wrinkle treatment injection. There are things like lasers, there's lights that can be used, there's special lotions and potions that can give you similar effects.
Yeah, there's lots of creams on the market now.
Lots of creams on the market.
Do that with the special ingredients.
Yeah.
I should tell you we've got 3 more calls waiting,
so
we need to keep moving.
That's fine.
That's fine.
But yeah, so there are lots and lots of other things available, and that's why it's really important to have a sit-down conversation with your private cosmetic practitioner and make sure they understand your needs, what your desires are, and ultimately you make a joint decision as to what's in your best interest. And sometimes that's not having an anti-wrinkle injection.
And I think after we've taken some of our calls, I'm going to come back and ask you about how do you assess that you've got a practitioner that's actually going to keep you safe. And it's not just about the money. Okay. Hello, caller. Who's on the line?
वालेकुम सलाम
अस्सलाम वालेकुम वालेकुम सलाम रहमतुल्लाह कौन बोल रहा है
जी मैं रोशन से बोल डॉक्टर साहब से मुझे कुछ क्वेश्चन पूछना है
अच्छा ਤੁਸੀਂ ਇੰਗਲਿਸ਼ ਵਿੱਚ ਗੱਲ ਕਰ ਸਕਦੇ ਹੋ
जी
अच्छा would you like to ask the question in English or पंजाबी ਤੁਸੀਂ ਸਮਝ ਲੈਂਦੇ ਹੋ
पंजाबी ਸਮਝ ਲੈਂਦੇ हिंदी ਸਮਝ ਲੈਂਦੇ
yeah both you can speak both
so what's your name sister
Naseem.
Naseem, okay. What's your question, please?
Rochdale.
You're from Rochdale, and what's your question?
Question is, I've got eczema.
Eczema?
And I'm going to ask what he recommends. I'm using steroid cream, but I get better for a while and then same again.
Okay, so you've been using steroids for eczema and you want to know if there's any treatments cosmetically that would help you. Is that the question?
Yeah.
Okay, does that make sense?
Yeah, that makes sense.
Okay, thank you, Naseem.
So I think you're doing a separate show on eczema altogether,
I am,
aren't you?
funnily. On the 30th, I'm recording a show that will be shown after that, hopefully. So there is going to be Dr. Preeti coming in talking about eczema.
Who I'm not an expert in eczema. I'm going to have to tell the truth. So it's not something I'm completely all knowledgeable about, but I have done my medical studies and I understand about eczema. So eczema is basically an inflammatory condition that affects normally, well, it depends, everyone's different, but normally this part of your elbows, but it can affect anywhere from your neck or anywhere. In terms of treatments,
should tell you we've only got a minute to do this.
Okay, so treatments wise, again, so steroids are really, really good at helping for eczema, but they have long-term consequences. I presume you've probably been to your GP and you've tried other treatments. There are special private cosmetic treatments that can be available for eczema, and certain light therapies can help. But I definitely advocate that you go to your GP because it completely depends on the type of eczema. And there's about 5 or 6 different types off the top of my head. So it completely depends on your type, how bad it is, where it is, and even the area of your body that's affecting will affect the treatment that we can offer you.
Okay. Well, coming back to 30 seconds, I guess this is a good time to let you know that whilst this isn't something that we can give more information on because it's such a personal thing to each individual patient, there is a program coming up in the future about eczema, so hopefully you'll be able to watch that. It looks like we've come very quickly to the break. I can't believe the time has gone so quickly. Thank you for calling in. Inshallah, we'll see you after the break. Assalamu alaikum.